Do you think we'll ever get back to the old normal, or is the new normal forever?
Well, I would encourage you to not think about the words getting back to normal, right? We all lost something, but we might be gaining other things and creativity and resilience. And so I think that looking back is not productive and it's a waste of time, and you miss the present when you do that.
Throughout the pandemic, Dr. Jen Ashton's voice has been calm and crystal clear, cutting through all the fear and uncertainty.
When you're trying to contain or respond to an infectious disease outbreak, you're always behind, so we need to take those aggressive steps now.
And this is the routine surgical mask. This is designed to actually keep viral particles in. Remember, your bubble is there for a reason. It's to protect your people and the people outside.
A respected journalist and practicing physician, the mother of two gracing the airwaves for hours on end, sharing and dissecting wave after wave of facts and figures on COVID-19. But despite her expertise, she too found herself at times overwhelmed.
You mentioned a moment where you hit a wall and you recognize, I have COVID fatigue.
It all started the night it was announced that President Trump and the First Lady had COVID. And within seconds, I was put on the air, first by phone, and then got on the air with Byron Pitts on television to talk about President Trump's COVID. And that was about 2, 3 in the morning.
President Trump had an array of people and protocols to prevent him from getting COVID, and yet he still contracted the virus.
Diseases do not discriminate based on your job title, your address, how much money you make, or anything else.
I had to take a step back and realize that we were talking about the biggest medical story in the world, the most powerful political leader in the world, and walking that fine line between respecting the patient's privacy, but informing the American public when the patient is our president. And at that point, I thought, I am really over this.
It's a sentiment we can all relate to. And when the day-to-day can feel panicked and paralyzing, Dr. Ashton has a prescription. Embrace this new normal.
I mean, no one has a crystal ball, but certainly this pandemic and the last year has taught us that it's not going away.
That paradigm shift is what she talks about in her new book, aptly named The New Normal. A message she hopes can empower readers to take their physical and psychological health into their own hands.
You came up with a mantra of facts over fear. How did you incorporate that to get over your anxiety?
What I did for myself was I said, okay, yeah, I am scared of COVID. What if I die and leave my kids without a parent? And then I went back to the statistics that, roughly 80% of cases don't require hospitalization. And then by age at 50, I have less than about a 1% chance of dying. At the end of the day, we can't worry about the what ifs or the unknowns or anything like that, because that's a slippery slope.
Anxiety and fatigue, an uptick in mental health crises dubbed the second pandemic. Often those hardest hit, working mothers.
Even in this time right now with this COVID-19, I can't afford not to work.
Biggest issue are dishes. To serve lunch, dinner, keeping them clean.
I usually get about an hour or so of uninterrupted work time. So there is also the fun fact that my son is in band.
Working mothers have suffered the worst sort of moral injury and stress and anxiety and burden throughout this pandemic.
I'm getting emotional just thinking about it, Juju, because we've all lost something in this pandemic. I think that if you don't acknowledge that loss and how tough it's been on our spirit, then we can't move forward to heal. And of course, women can be disproportionately affected by that.
As a nutritionist, Dr. Ashton says having to grapple with those tough moments has forced many of us into unhealthy habits.
You admitted that you fell off the exercise regimen, which was easy for all of us to do during the pandemic.
For me, exercise before the pandemic was my major form of stress relief. So I literally did what I advise patients not to do. I let everything get disrupted. I stopped my meditation. I stopped my regular exercise. I wasn't paying attention to what I was eating. And by the time June 2020 rolled around, I wasn't feeling good. So I literally spoke to myself as if I were my own patient. Figure out a way you can do it. And it took a couple of months, but it did get me back to where I was before, but it was hard.
Despite all the loss and upheaval, Dr. Ashton says there's no doubt the pandemic can teach us all, however difficult, to choose gratitude.
I think we've learned new ways to stay connected to people that we care about. My new hobby was raising backyard chickens.
You've become a suburban farmer.
I totally have. 2 years ago, if you had said that to me, I would have said, oh, no, that's not for me. And so I think there are some silver linings in there. You just have to look for them.
A lot of people are feeling hopeless and negative out there. What would you say? What's the one overarching message for them?
I think that our resilience for sure is being tested, but I think we're stronger than sometimes we give ourselves credit for. And I do believe that we will get through it stronger than we were before the pandemic.
Dr. Jennifer Ashton's new book is available in stores now.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.